Hello everyone, friends, family, colleagues. We're at a crossroads in human health and civilization. Despite unprecedented spending on medicine, hospitals and pharmaceuticals, more than $9 trillion in 2020 was spent alone. The burden of disease continues to rise. In Australia, nearly half our citizens live with chronic illness. Cardiovascular disease, cancer, diabetes, obesity, autoimmune conditions, and mental health. Mental health disorders are no longer exceptions, but the norm, and it's getting worse. Hospitals overflow, costs spiral, and public trust is ending. It's eroding. Why is this so? Because we've built an industry of illness rather than a culture of health. We've created a system that is rewarded for managing disease rather than for creating vitality. Patients are stabilised, medicated and returned to the community, but rarely restored to true health. The system excels at crisis intervention, but fails at prevention, and in doing so, it betrays the very trust placed in it by us. The COVID-19 pandemic laid bare the frailty and flaws of this model. Governments narrowed their vision to pharmaceutical responses only. They silenced dissent, ignore nutritional and preventative measures, and eroded the sacred principles of free, full and informed consent. It was not only a crisis of health, but a crisis of governance and ethics. Even beyond COVID, the real epidemic that stalks humanity is chronic disease. Every year, heart disease kills 18 million, cancer almost 10 million, and diabetes and obesity spread relentlessly across populations. I'm talking about worldwide. Meanwhile, mental health disorders have become the leading cause of disability worldwide. These are not mysterious misfortunes. They are the predictable outcome of lifestyles, environments, and policies that neglect root causes, including drugs, medicines, and vaccines. We see this in the stories of ordinary people. Margaret, a woman with a heart disease, is placed on 9 drugs by 3 different specialists. Nobody asks about her diet, her sunlight exposure, her vitamin D. James, a young boy with ADHD, is medicated without a single conversation about his nutrition, his sleep, or the stresses in his home. These are not isolated tragedies. They are the structural failures of a system designed around pharmaceuticals and procedures rather than prevention and wellness. What then would a truly new system look like? It will begin with a radical shift in perspective, asking not how do we treat disease, but how do we create health? It will be grounded in a vision of wellness as vitality, resilience and purpose. It would integrate the best of conventional medicine with nutrition, environmental science, lifestyle medicine and natural therapies. It would be citizen-centred, transparent and resistant to capture by industry. Resistant to capture by industry. To achieve this, governance must be reimagined. I propose the establishment of a National Wellness Authority, a body independent of pharmaceutical interests and political short-termism. Its role would be to safeguard the integrity of our health system, to set standards, to accredit community wellness hubs, and to fund research in nutrition and integrative medicine. Oversight would not be left to distant bureaucrats alone. Citizen councils, selected like juries, would review policies, hear grievances, and hold the system accountable. Every decision, every contract, every expenditure would be radically transparent. Logged on, open ledgers, visible to all. This is not utopian, it is the necessary antidote to decades of corporate capture. The architecture of such a system would be simple, yet transformative. At its foundation is the individual. Each citizen equipped with knowledge, literacy, and access to personal health tools. Imagine a world where every person has their own AI wellness coach, a guide that integrates wearable devices, nutrition tracking, and biomarker monitoring, offering personalised guidance and support in real time. This is not surveillance, it is sovereignty, with data owned and controlled by the individual. The second layer is the community. Across the nation, we would build wellness hubs, Wellness hubs are centres staffed not only by doctors, but also by nutritionists, natural therapists, psychologists, and allied health practitioners of all types. These hubs would run programs for reversing diabetes, preventing cardiovascular disease, reversing heart disease, reducing hypertension, supporting well-being, and enhancing resilience. They would become not only places of care, but also anchors of community, sanctuaries of education, prevention, and healing. In times of crisis, they would distribute nutritional packs, supplements, and guidance, supporting the citizens long before the hospital becomes unnecessary. The third layer is the hospital, but not reimagined, no longer factories of illness, but sanctuaries of healing. Acute and emergency care would remain at their heart, but they would integrate the full spectrum of science, from intravenous nutrients, vitamin C for example, hyperbaric oxygen therapy, to integrative oncology, psychiatry, rheumatology, etc. AI systems would assist in triage, directing patients into wellness pathways where appropriate, and rehabilitation would always link back into community hubs to prevent relapse. Artificial intelligence has a role here, but not as the tool of surveillance. Not as a tool of surveillance capitalism, it must be the nervous system of the wellness designed to serve the citizen, not the corporation. Clinical intelligence systems can scan global research in days instead of decades, ensuring practitioners are always up to date. Predictive analytics can identify risks in communities long before they manifest as disease clusters. Governance algorithms can track spending, conflicts of interest, and adverse events in real time, ensuring corruption becomes impossible. Patient-facing AI can provide multilingual, culturally adapted guidance, reducing inequality and empowering the vulnerable. Yet safeguards must be absolute. Transparency, human oversight, and the right of every citizen to refuse or revoke consent. Such a system must be rolled out in phases. In the first 3 years, we establish the National Wellness Authority, launch pilot hubs, reform medical education, and begin deploying personal AI coaches. By year 7, we expand hubs nationwide, embed integrative oncology, etc., and nutritional psychiatry into hospitals, and fully integrate wellness into Medicare. Within the 15 years, Australia can export this model globally, creating a World Wellness Council and positioning our nation as the birthplace of a new era in health. This is not only socially desirable, it is economically rational. Every dollar invested in prevention returns $5 to $10 in reduced treatment costs. More importantly, it restores trust. It rebuilds communities and reduces suffering and will bring back trust. But safeguards are vital. Informed consent must be absolute, never again to be sacrificed. Data must belong to the citizen, never to the commodified. Transparency must be the rule, not the exception. Indigenous wisdom and cultural diversity must be integrated, enriching the system with knowledge as old as humanity itself. Above all, this must be a moral project. Health is not a commodity to be traded, it is a birthright to be protected. And why Australia? Because we are large enough to matter but small enough to move. We have Medicare as a universal foundation. We have a proud history of pioneers in integrative and nutritional medicine. We are multicultural, making our system globally adaptable. And we are independent enough, geographically and geopolitically, to lead boldly where others hesitate. Folks, the choice before us is stark. We can continue down the path of spiralling costs, rising disease, and eroding trust, or we can choose courage, humility, and vision. We can create a system that empowers citizens, prevents disease, and restores dignity. We can move from an industry of illness to a culture of wellness. The world does not need more disease management. It needs health creation. Australia can be the light on that path. Together, let us build a real wellness and healthcare system, not only for ourselves, but as a gift to all of humanity. So I close with a big thank you, and I will be moving this as far and wide as I possibly can.